And Carol, good morning. We'll give folks a
Good
minute to
morning.
join. I'm also going to put in the chat the link for the recording from yesterday's Mass Taxpayers Foundation's meeting about the governor's budget. And we know Victoria will also be in the 9:30 call tomorrow to review kind of what was in the governor's budget around early education and care. And then next week, Strategies for Children and Neighborhood Villages are planning a kind of follow-up event to talk more about what the proposal means to you and next steps for advocacy. So we'll put those links in chat. Um, I guess we haven't really done the Super Bowl poll yet, so maybe in chat who is everybody rooting for the Super Bowl? So I guess Eagles, Chiefs, or snacks. Maybe that's kind of what you can put in chat, whether who you're rooting for in the Super Bowl. Go Birds. I'm expecting that. Yes. Thank you, Neri. Put all the links in chats. Thank you. Oh, halftime show. Yes. Who is the halftime show? Soccer, says Danette. Donna Danette.
It's
Great.
Kendrick Lamar.
Lamar.
Oh, big winner from this week from Sunday night. Thank you. Wow. Leslie Baker on it. Well, good morning and welcome. We're so glad to have folks with us. Kara and Vita, it's so good to see you. And so we'll turn things over to you for each of you, tell us a little bit about you and how you came to be in your current role. And then we'll excited to hear the update.
Okay,
Yeah,
great.
yeah. Oh my gosh, apologies. Yes.
Great. Should I go first and then
Sure.
I'll give a short introduction to what Parent Child Plus is for those of you who don't know much about us. And then I will turn it over to Vidya. Um, I'm a social worker. I have been for many years and am committed to supporting and strengthening families and children. Uh,
Carol, you got to give us more than that. How'd you come to be in this current role? What'd you do before that? How long you been a Parent Child Plus?
Um, let's see. I've been a Parent Child Plus for a very long time. Um, I actually started my career founding a nonprofit parent support center called Warm Lines for the western suburbs. So Warm Lines was the beginning of everything in terms of parent education and family support. And that was an agency that served the western suburbs for about 15 to 20 years.
Yeah.
And then I became the coordinator of Parent Child Plus in Newton, Needham, Wellesley, Waltham, and expanded the program to Watertown and Brookline, and got very involved with advocacy and trying to lobby to have state support for Parent Child Plus. I've been the state director in Massachusetts for longer than I want to remember, but well over 15 years. Is that enough?
Thank you, Carol. Yes, see how much more that is? Thank you.
If people want to talk more, I'm happy to
Oh,
talk.
yes. Great.
Please. Okay, I'll begin with giving you some background. Parent Child
Perfect.
Plus's mission is to ensure that all children, regardless of their race, socioeconomic status, or zip code, have equal possibilities from the start. We work with families, caregivers, and communities to support not only early literacy and school readiness, but early opportunities. Our approach to supporting parents and caregivers is based on decades of research on the importance of adult-child interaction, demonstrating that children's cognitive and social emotional development are best nurtured through positive relationships with primary caregivers. Parent Child Plus was started in 1965 by a developmental psychologist at the State University of New York at Stony Brook, who believed that strengthening positive verbal interactions between parents and children could help to level the playing field. Currently, the program is implemented in 16 states and serves over 7,000 families with two models. The family home visiting model, in which an early learning specialist works with one family at a time, and the home-based childcare model, the HBCC model, working with family childcare providers and the children and families in their care. Both models are replicable and scalable across diverse communities in many languages and contexts. Parent Child Plus's National Center provides the training, quality assurance, professional development, research, and evaluation support to replicate our models in social service and healthcare agencies, community-based organizations, public schools, housing authorities, and other lead agencies. And I might say that in Massachusetts, the majority of the lead agencies are the public schools. So we work very, very closely with the early childhood departments and the public schools. In Massachusetts, we have 45 sites across the state, from the Berkshires to Boston, from Lawrence and Lowell to the Cape and Nantucket. Last year, we worked with over 3,300 children and parents through 169,000 home visits, distributing 34,500 books and toys. And for many families, these books, many of which are bilingual, are the first libraries that they have. Families in the program speak 32 different languages. 72% of families whose home language is not English are supported by an early learning specialist speaking the same language. And 53% of the parents were born outside of the United States. And I think Vidya is going to put into the chat an information sheet for Massachusetts, and there's a lot of data on that. So please email me, call me for any additional discussions. Would be happy to talk with you. Vidya,
Great.
it's your turn.
Thank you so much. And thank you, Amy and Strategies for Children, for having us. Hello, callers. We're so happy to be here and share with you a bit about our home-based childcare model. I'm going to share screen, and then I'm going to try to
Great.
put documents in the chat.
Perfect.
Yeah, so I'm Vidya Ragoo. I'm the National Director of the Home-Based Childcare Model. Carol, you just heard from, is the Massachusetts State Director, and Jane and Jeanette are here with us on this call from the Early Childhood Alliance of Framingham. They implement the model on the ground, and I'm hoping that they can share some of their stories with us. Before we get to that, I hope to do a quick 2-minute overview of the history of the home-based childcare model, and then really get into the model practices and statistics in Massachusetts, as well as the data outcomes in Massachusetts. And I'm hoping Jeanette and Jane can share some of their stories behind the data. So our origin story, as Carol said, is we're a 60-year-old organization, and a happy anniversary to Strategies for Children too. I know you're celebrating a big milestone this year. We started out with family home visiting. A lot of families who could not continue with home visiting because they got work or school opportunities asked us to continue with their children in childcare. Family friend and neighbor care and kin care is a part of our model. In Massachusetts, we work with family childcare providers who are licensed, or group family daycare. And overall, we call ourselves the home-based childcare model. Both of these pictures are from Massachusetts, and we love our Massachusetts providers. In Massachusetts, we are where all of the dark blue areas are. So home-based childcare and the family model exist in these counties, and the family model exists in the yellow counties, and we're hoping to expand the home-based childcare model, both in the counties we're already in and in the counties that we're not in. I'm not going to talk about this little place that has no presence. Our basics, just in terms of what it is that we do on a daily basis, we visit family childcare providers during childcare hours. We do this for 24 weeks, a total of 48 visits, and we deliver practice-based coaching to them. We do an assessment on their strengths and goals, and we work on enhancing those strengths that they already have. We provide opportunities for providers to use a variety of instructional strategies to meet the needs of all children. That has been one of the biggest asks in the past couple of years, because children are coming in with needs that are much higher than we are used to. We also offer developmentally appropriate materials to the care environment, to the children's homes. We promote family engagement activities, and we connect providers to local resources. A lot of the providers that we work with seem disconnected from local resources, so we really try to get them into the Massachusetts systems and all of the wonderful community provisions that the state really provides for child caregivers. In Massachusetts, we, in 2023, worked with 53 childcare providers who had 25 staff at their child's program, their early childhood program as well. We impacted 360 children in care, and we have a total of 14 early learning specialists across the state. With all of that, we've completed 1,641 visits in 2023. We have given away 820 books and toys to provider environments and to children's homes. We also provide guide sheets that extend learning, opportunities for parents and providers to engage in readily available activities as well as connect to readily available resources. Our outcomes, I first want to talk about a national study that was done at Stanford. We really wanted to know who our providers were and what kind of hardships they were experiencing. So the Rapid EC survey is a national survey. They work with providers across the nation, and they also did a study with our providers specifically. And what they found was all the providers across the nation are experiencing food, utility, housing insecurity. They're struggling with well-being and healthcare. For the light green bars, these are the providers we work with. They have across the board higher needs than the national average. We were really curious about their mental health during the pandemic and beyond. And what Rapid EC was able to show us was that, yes, mental health is huge among family childcare providers. They're all across the nation experiencing distress and anxiety and depression. But what was a really interesting finding was that the providers working with Parent Child Plus were experiencing much lower levels of mental health issues, loneliness and stress, which is just a huge outcome for us. We love seeing this. This is not something that we measure on our own, but really glad to partner with Stanford to get this data and also to learn what kinds of resources our providers need. Specifically in Massachusetts, we use the Child Caregiver Interaction Scale as our assessment. We measure the child care provider's interaction to develop children's emotional, cognitive, physical, and social skills. And the pre-tests, which is within our 6th visit, are the light blue bars, and the post-test at the end of about 48 visits are the dark blue bars. So we are experiencing across the board increased capacity for providers to engage in these really critical activities for young children. There's a total increase of about 39%, which is huge. And we love our early learning specialists and providers who are willing to learn and grow together. Program satisfaction to me is also really, really important data. We want to know how satisfied our customers are. 96% are well and extremely well satisfied, which is really great for us to know. And it's also really great for us to know that 100% of the people that we visit with feel like they're respected and they're treated with respect. People also find our program easy to enroll in, which is also really nice. We rely on our providers. And this is not something we ask them to do, but we do rely on our providers to spread the word about our program. And a net promoter score is how many providers are willing to be like advocates for the program, like promoters. So we have 2% of our population of providers are detractors. 3% of the population are passive promoters, and 95% of our providers actively promote our program, which is how we really spread the word of what it is that we do and what it is that we try to accomplish in the home-based childcare model. We asked our providers in Massachusetts, like, why do you love promoting and why do you have such high completion rates? 48 visits is a lot to complete for a family childcare provider. And they really mentioned the trust and the relationship between the home visitor and the provider. They love having a level of predictability and structure and at-home routine. So they love that we come into their home at a specific time, have guide sheets and materials, really coach the provider to engage in activities with the young children, and we're there to serve as a support to them. They always tell us the new and stimulating materials is what they keep coming back for. And they really uh, get out of the entire model the strategies that promote school readiness. So we're happy to hear that everything we're trying to do is what we are doing. This is a data sheet that I'm not going to go that into, but I'm very interested in this data element as well, which is how much of an impact do you think we're having for the long term? So while we're there for 6 to 9 months, we really want to have an impact, but does this 6 to 9 month intervention have long-term impact? And 89% of our providers said it does, which is really kind of the mark we want to leave in the community, really building the parent and the provider capacity to be their child's first teacher and to ensure school readiness for their young children. Family feedback is really important to us. So families also report improvement in provider interaction and activities and learning environment. Families also get a lot from us. They've received books and toys and information and guide sheets, as we talked about before. 100% of the families were aware that their providers were working with Parent Child Plus. And families overwhelmingly felt that the materials that were distributed were really helping them to build school readiness skills with their young children. I do want to pass it on to Jeanette and Jane. They are really the people behind the data and behind the stories of what makes this model possible. So Jeanette and Jane are here from the Early Childhood Alliance of Framingham. Hi.
Good morning. How are you?
Good morning.
We're sharing a screen because we were having a little technical issue.
I love it. It's so great to see two folks tuning
Well,
in.
we're always together here. That's our thing. Teamwork, 100%. But I'm Jane Cohen from the Early Child Alliance of Framingham and a coordinated family and community engagement program, as well as the Parent Child Plus program. We fortunately, with National and Carol, offered us the opportunity to do the home-based model. And so I really knew the perfect person and already in our staff to take a lead on implementing this program. That would be Jeanette Lake, who has been with us a little over 9 years. She was doing the core model. And then before that, she was a kindergarten pre-K teacher in the Boston Public Schools and has an educational leadership master's as well. She knows how to work with families, educators, children. She loves it all. So I just want to introduce her at that level, and then she's going to go ahead and share her experience as an early learning specialist. We thank you for this opportunity, and we really did find those findings that Vidya had shared are absolutely true. And then I'll let Jeanette speak to the rest of it. Thank you.
Hi, my name is Jeanette Lake, and I'm going to echo a lot of things that Vidya and Jane have already said. I've been here with the Early Childhood Alliance of Framingham for 9+ years. And prior to coming to Framingham, I was a kindergarten 1 teacher in the Boston Public Schools. The Boston Public Schools has 3 levels of kindergarten. K0 is involved with early intervention, and they're 3-year-olds. And K1 is a 4-year-old program, and it's open to everybody, but they don't have enough of the K1 programs for every child in Boston. So it's like hitting the lottery when you do get into K1. Okay, and throughout my career, I've always been committed to enriching the lives of very young children, as well as coaching and mentoring families and colleagues. As an early learning specialist in the Parent Care Plus core program, I had the opportunity to gain more experience working with parents and sometimes the entire family and children, of course, but children who were not my target children. Building a trusting and professional relationship is most important, and also to recognize the strengths of parents as educators and support them in their role as their child's first teacher. The ELS also performs the task of sharing with families valuable community resources. And that is also true in the home-based program as well. Making the switch from the core program to the home-based childcare was very rewarding for me, somewhat challenging in the beginning. One thing about Framingham, it's a very diverse community and city. And all the educators who have participated in my program were either bilingual or trilingual. I myself am monolingual. So it was a challenge because no one had English as their first language except me. Now, what was really key and important was establishing a trusting and professional relationship with the providers in the program. Some of them felt like they had been providers for so long that maybe there wasn't that much I could do to help them. But as we worked together, we did build this relationship, and we saw that I acknowledged their strengths and their unique qualities, and they really appreciated the support that I could give them. We provide books and toys for them, but also a listening ear where providers can talk about their concerns with children in their program. We have a mental health component, which helps providers figure out ways to work with children who may have some challenges in that area. We also offer them the opportunity to share resources with the families that they serve. So if I know that there's a clothing drive, a coat drive, or a boot drive, or whatever, I can contact the parents through email, or the provider could also contact the parents and let them know when that is, because they might not know otherwise. As I said before, each of my 6 people that I have worked with is unique and special. And through reflective practice, I strive to discover what their individual skills are and to recognize them and encourage them to evaluate what they're doing in their curriculum activities. The Parent Child Plus program provides tools such as curriculum guide sheets for the books and the toys that they're also providing, and also other supportive materials that providers might need to implement their programs. At the beginning of each program, we have an open house in order for me to meet the parents and explain what I am doing in the home with the provider. And they'll have the opportunity to meet me and see who is coming in to their child's program. And I share with them how I can support the child care provider and also give them information as well. And they know that they will be filling out surveys, and we'll discuss how what I am doing is going to trickle down to them and help them to read books with their children and discuss books with their children and use use strategies to help children understand the books better. And all in all, I've truly enjoyed my experience of working with these home-based educators. I love meeting them where they are and working to bring out the best in them. I love watching the little children grow and meet their milestones. It's truly been a very rewarding and pleasant experience for me. The educators have stated to me in their surveys how much they value the program. Most of the providers I've gotten through word of mouth. Like I started off with one provider, and she is now recommending me to the 7th person that I'm going to be working with. And I think that's huge, because they know that I'm someone they can trust. They know that I'm not evaluating them. They know that I can truly help them, connect them to resources in the community, and that I'm providing materials that they need for their program. Providers have also said, you make me think about what I've been teaching to the children and why I'm teaching what I am teaching. And Also, some providers have said that they wish this program did not have to end after 12 weeks because they wanted to just go on and on and on. They want that continual support. Some have also said that I've made the curriculum more meaningful to them, and thus far they can make it more meaningful to their children. And another one has said, you've given me so many great ideas. And I feel like I have learned from the providers too, because there's nothing like seeing the work in action, seeing what they're doing and how children are learning. And that's it.
Thank you to both of you for that update. And I know there's been a lot of activity in the chat. Somebody messaged me and said, I came in and it's very confusing to see the Puppy Bowl, snacks, Kendrick Lamar, the Vineyard. So there's been a lot going on. And I know that you folks have been answering. So one reminder from Paula that we don't say daycare, that we say childcare. And then there was a map that was shown about the coverage area of Parent Child Plus. And so the Vineyard, but then Vidya answered that in chat about thinking about how to expand there. And then just the term group family daycare. And then Ariella said, I believe it's another term. But I think there's group care, which is centers, and then family child care is different. Just 'cause it's like a licensing thing almost, and like a classification. And right, group school. It's so group because group family childcare also can include school age. And then I added in the chat that our blog today is covering the community coordinated community family and engagement grantee. So it's a two-parter. But many of the stories that Jane was sharing too, we know that CFCEs are also providing that kind of support. Donna Jeanette says many providers are disconnected out of sheer necessity, lack of capacity. Many are drowning. And then Vidya shared kind of like what the support might look like for that. Carol added, we're interested in expanding the model to offer it to additional providers. Please reach out further to discuss. And Vidya added resource in the chat. Harold and Paula wondered, do you help the providers to get their families into their programs, vouchers, families, or private pay families? So Vidya said, yes, referrals for all these needs to be part of the model. Yeah, then Carol wrote back to Laura. And then yeah, there's a lot of and someone said they can't save the chat, so I'll also look at that because people used to be able to save the chat. That Carol added home visitors speak multiple languages. We know that often has come, people are very thinking about that. Okay. And then there was a question I saw from Kim Davenport earlier about whether you work with independent family child care providers or family child care providers and systems, and it looks like it's everybody. Somebody who was that? This is exciting. I'm gonna get this into my area. Thank you, thank you. I guess as you look through the chat or any of the questions, I'm sure people are getting private messages. So Carol and Vidya, I'll give you the last word now. Anything else you want us to know? And if Vidya, if you send us the slides, we'll post that, and we'll also post the PDFs that you shared in link.
Great. Oh,
Thank you so much. Go ahead, Carol. It's just Carol, you're still on mute, so I think you're talking. But I'm just going to say it is so lovely to see all of you here on this call. I've been joining since early this year. The work in Massachusetts is amazing. If I could live in a state other than New York State, it would be Massachusetts. You guys do like the most incredible work for your young children. I'm also super excited to see Jane and Jeanette. And Carol, you can have the final words.
we're so grateful for this opportunity. We'd love to come back.
Sure.
We're always collecting more data, more stories, and it's wonderful to see so many friends and colleagues on this call. It's really quite remarkable. So thank you for this opportunity. And if you have suggestions for us, if you want to continue the discussion, please reach out because we're really trying to expand this model and offer it to so many more providers who are asking for it and who feel isolated and would benefit from it.
And special thanks to Jane and Jeanette for joining from the same screen and sharing kind of the on-the-ground perspective. We certainly appreciate hearing that. Okay, thank you, Massachusetts. We will see everyone tomorrow. We'll hear from Victoria It's been an incredible week of the 9:30 call as always. But so we'll look forward to seeing everyone tomorrow morning. Thank you so much and have a great day.